The first question that I want to ask is, as Chief Executive Officer of your state, can you give us a status assessment of the impact that COVID-19 pandemic in your state, and what structures have you put in place to stop the spread of the virus as we enter into this phase of gradual reopening of the economy?
Okay, first, I'd like to thank it's good to talk to Nigerians concerning Delta State. Actually, as at today in Delta State, we've recorded 17 cases. We've had 2 discharges. Unfortunately, we've had 2 deaths, and the rest are currently being managed in various facilities. In Delta State, right from the beginning, we knew that we're likely going to have, of course, the COVID-19 with us. So we set out to have a task force. Our task force to manage all issues concerning the COVID-19 was actually inaugurated on the 16th of March. And thereafter, we set out to put our medical facilities in place. Currently, today, we have 4 isolation and management centers, 2 in Asaba, the Federal Medical Center, and the Asaba Specialist Hospital, 1 in Warri, the Warri Central Hospital, and Delta State University Teaching Hospital at Owara. These centers are all properly equipped, and the right personnel have been trained. We've trained well over 400 staff at the moment. Both the head team made up of doctors, nurses, laboratory scientists, pharmacists, and also some auxiliary staff with them, including the drivers of ambulances, drivers of various vehicles that will be required with the epidemiology team. Of course, our emergency operations center has been activated even before the 16th of March. And having done all this, we have continued to put structures in place to ensure that we have public education of our people on the need for them to be able to incident suspected cases, and also on the need for them to ensure that they regularly wash their hands, maintain social distancing, and also on the use of hand sanitizers, along with all other things that we talked about having the proper etiquette. These isolation centers will try to put in the best of shape, and in the management of the cases that we have at the moment, I think we're doing very well. We also have to provide logistics in terms of providing enough vehicles for the contact tracing team, because it's very important. For every case that you have to ensure that the contact tracing is adequate and full. And thus far, we have traced 182 contacts, and we have traced all contacts of all our patients. 182 at the moment. Apart from the patients that were recorded just 2 days ago, we are still in the process of contact tracing of those patients. So as at the moment, we are fully prepared, and our medical team, they are in they have a high commitment, and they are passionate about doing the work. It's a very difficult work. We have ensured that we have also provided enough personal protective equipment for them, and we ensure that the team is trained on all aspects, because we have those who are in charge of the IPC, that is the infectious prevention control, and also those who are in charge of case management. And we have also had to train those who are in charge of the laundries, those who are in charge of the incinerators. There's a whole lot of training that has taken place. And I think everything is currently working for us. We've had a whole number of ambulances put up for the team, because up until 3 days ago, all our samples were taken to IRA, Specialist Hospital, for testing. But today we're lucky. We have a mini testing laboratory, and since the past 2 days, tests have been carried out directly in Asaba here. So a lot has been put in place, and we function very well.
All right. One of the reasons why we chose to speak to you, your are a medical doctor by profession. So I want to ask you this question. Which part has been the most challenging to deal with? And why has it been the most challenging in this battle against COVID-19 in your state?
Actually, the challenge that we've had is two-pronged. One is being able to deal with the issues of the economy of the people, particularly the informal sector, because in the process of trying to stop the chain of transmission, we have had to undertake a lockdown. And in dealing with that, it's actually very, very challenging for the fact that most of our people are in the informal sector and they have to live on a daily basis. They make their monies on a daily basis. And once you start that process, it means that you're going to keep their families hungry. That was obviously a very major challenge, which we're doing our best by way of being able to provide palliative support for critically for the more indigent of the families. The second challenge that we did have is this issue of stigmatization, because our people are beginning to believe that having COVID is something that must be stigmatized, and we have been trying to get carry on with education of the people to realize that this is a disease that can actually affect anybody, the high and the low. There's nobody that's exempted from it. And if you have not had it today, it's only because you're just lucky or you have not been within a place where you can easily get infected. But we also do know that with the education we're carrying on, people are beginning to understand, and people are also beginning now to come out on their own to get themselves tested. Because the more you stigmatize the people, the more the patients will hide themselves in and continue to infect the people. So these have been the two ends of the challenge. The economy of the very low within the society, and which actually has been a huge problem. We've tried to provide those palliatives, but we know that we continue to have problems. However, in Delta State, we've already started doing an easing of the lockdown. And I think that even while we continue to provide palliatives, it's going to be much easier for us to manage at the moment.
All right, sir. I'm going to ask you one last question that has to do with the economy. How has COVID-19 affected your plans that you had for the state at the beginning of the year? And will you still be able to fulfill all obligations? If not, what are the changes that you are making?
Obviously, there is a huge challenge on our hands with the COVID. The Nigerian economy has been such that we are largely dependent on oil funds, and Delta State is one of the states that depends a lot on the oil funds, largely because also our workforce are better paid than workers from many other states of the Federation. And on that note, with a very shortfall in oil revenues, obviously it's going to impact on us. We are very mindful of this. We are beginning to review our budget, and there's going to be a scale down of our budget, but in such a manner that it will have while we continue to engage on some of the very critical infrastructure work that we are already involved in, like construction of roads and renovation and construction of schools, keeping on with our health system staying strong. We also have to begin to readjust the budget in such a manner that we're able to impact on the populace, because the effect of the COVID-19 is going to make the poor poorer. And even those who are in the middle class, some of them are going to fall into the poverty bracket. So we are going to have ourselves readjust the budget to improve the funding, even with more limited funding, to improve the funding for social investment, to improve the funding for agriculture, to ensure that we're able to assist our farmers to be able to grow more of their products through all forms of support in terms of better planting materials, being able to support them with fertilization, being able to support them with fertilizers and the rest. And we are also doing everything humanly possible to begin to engage more of our youth. We have various forms of youth training programs, the Youth in Agriculture program, the skills training program that has been doing quite a lot, and also the girl child training program. All this we're going to enhance the amounts of money available for them in the budget to be able to train more of our youths and then keep them out of the street. Because the more of our youths are on the street, the more likely we're going to run into crisis concerning managing the security and managing the protection of our oil facilities. We are also looking very closely to see how much can support the small and micro enterprises that are in the state. And funding is going to be enhanced in this direction. But obviously for the infrastructure, while we must continue with the critical infrastructure that have reached a reasonable level of completion, some of the initial programs that we had are definitely going to have to wait on until the year 2021. But the mix of all this we're putting in place before the end of next week, we're likely to go back to the House of Assembly to ask for a reordering of the budget in such a manner that it will be more productive for us as a state and for our people, because we are quite mindful of this. And the health of the people is also very important, while we continue to ensure that the facilities for the management of our COVID cases remain very functional. We are health program, which actually ensures that every vulnerable person in Delta State is enrolled in our health insurance program. We must ensure that we continue to offer these services to our vulnerable persons, particularly children under 5, our pregnant women, and our elderly and the widows. And we have to continue to do this to be sure that we do not allow the impact of the COVID come very strongly against the very little finances available at the family circles. So we must do everything possible to empower the family to succeed going forward in the next few months of the year.
Thank you very much, sir, and for taking out time. Thank you for the work that you are doing to protect the people of Delta State and Nigeria at large. God bless you, sir.
Yeah. Thank you so much for having me on this program. God bless you.
All right, then. That was the Executive Governor of Delta State, Governor Ifeanyi Okowa. We still have a few more governors. We have a COVID survivor who is going to talk about his personal experience. We have a medical doctor who is working in the Center for Infectious Disease and is directly involved in the treatment of patients. So we still have very interesting things that are coming up. We'll be back after this timeout.
And it's still today the platform talking about Nigeria's battle against COVID-19. And I have two very interesting people with me at the panel. I know I had some other guests before we went away, but they will be back shortly after this conversation. So I have with me to my right, maybe I should start from the far right, Doctor with the mask. Dr. Chris Ezezobor, thank you for joining us this afternoon. And you will tell us why you have chosen to keep your mask on, seeing that we are all on masks, but we are keeping our safe distance from you.
Thank you for having me.
Thank you so much for being with us, sir. And I have Mr. Emmanuel Asika, who is a COVID survivor.
It's a pleasure being here with you.
It's a pleasure having you. And maybe you should start with your story, actually. You know, many people who have had this COVID, people are locked up in, not locked up, hospitalized in IDH. The symptoms are there, some are asymptomatic, but you went through the whole stretch of having the virus, contacting the disease, being symptomatic, being hospitalized. Tell us about your experience.
Okay.
As short as we can tell it in the little time that we have.
Exactly, because I believe it's a very long story, so I'll try and compress it.
Okay.
And obviously, talk through the talking points. First thing is, I I thought I had malaria. Okay, so like so many people today, we thought that the disease was far away. It was not something that we could contract. So when I had a headache, when I had body pains and a fever, first thing that came to my mind was malaria. So I went to the hospital, and the doctor did confirm that it was malaria after the test. All right, but 2-3 days later, when the fever persisted, and then I had diarrhea, we decided to, I decided to go back to the hospital, and then we tried to do some further tests. I think what for me is the first thing that I like to highlight is the fact that a lot of people think that this is just a respiratory disease, and then you have a cough, shortness of breath, and the fever, but I had diarrhea, and it's actually heartwarming to see that the Lagos State Ministry of Health has added that as a symptom for people to watch out for. So I did a test, and then it came out positive for COVID-19. Of course, I was shocked. At times like that, you get to, when you're faced with mortality, your perspective to life changes, and then you begin to say, what are the important things in life, and how do you refocus, and all of that. And of course, it took a while for me to get to a place of acceptance and decide that let me face this head on, and hopefully I could recover.
So when you got the result back, did you immediately then go to the IDH?
Yes. I had already been admitted in the hospital for about a week because I was dehydrated. At this point, I had what the doctor probably would elaborate further called gastroenteritis. So I was nauseous, and I was vomiting, so I couldn't take in food. And so to help me get back my fluids, I was put on a drip, and then I was hospitalized for about a week. And then after that, we did the test, and so the hospital moved me directly to the IDH, where I continued the treatment.
So how long did this whole process take?
The process of
healing, of recovery?
Oh, yes. Yeah. So after I got to IDH in Yaba, I spent another 10 days.
Wow.
Yeah, so... Yeah, and mine was almost a fast recovery, because I know people have spent 21 days, 40 days. I suppose that it depends on how well your body, your immune system fights and battles the disease, because obviously there's no cure at the moment. So 10 days was, relatively short.
What might you say was your greatest lesson through this whole situation?
A couple, actually. Number one, the bias against government institutions.
Yep.
I was worried as well when I had to leave a private hospital and had to move to the government facility. I thought, like most of us do, that things wouldn't be properly done there, but I was pleasantly surprised. I mean, the facility is world class. You saw also the one that was launched in Bagada. It was world class, but more importantly, they also have doctors that are true professionals, people that I always use any opportunity I get to say thank you for the absolutely amazing job that they did. So that, as well as the fact that most of the times, when I got out, I'm shocked to see that people still think that this is a ruse. People still don't believe that this is real. And that's actually informs the choice to come out and go public and say, look, I mean, you may think that there are ghost numbers, but here is someone who is a survivor, someone who's gone through the process, someone who can be your brother, your friend, your relative. And who has come out to say this is real. Sometimes we minimize what we had to go through at the center, but it was really a gruesome experience, especially when you're at your lowest ebb, when it seems as if the disease has taken complete control of your body. But after a while, it did get better. But it's important that we keep sensitizing the people to let them know that this is real, it's easily contractable, and if we do not work together as a people, it will defeat us.
I'll ask you one last question before I go to the doctor. Were you afraid of stigmatization? Because it's obvious that some people, once they say you had COVID, it's like, stay away from me. So, and some people have talked about how that's why they don't even want to say that they had it, even after they are now negative, because of the perception of even family and friends as to the fact that you had this. So for you to come out and publicly, boldly talk about it, why were you not concerned about that in a way? Or even if you were, why have you chosen to still come and talk about it?
Yeah, so stigmatization is real. I mean, I have seen it happen to so many people. Maybe not me directly. I suppose one of the things that helps is the fact that there's a lockdown, so we don't get to interact with people for, so much. But I have had some little interaction with people in my area, and maybe, again, it's because of the circle of influence and circle of friends that I have. They are well educated about the disease. And when I came out to say, look, I had this, I became a pseudo-doctor because they were asking me questions about how did it go, what are the symptoms, and all of that. And we've been doing that repeatedly in various platforms. I have heard just one case, a very interesting case, when a friend of mine, we did get to meet and have a conversation, and then he went back to his office, and then he said, I just met with Manny, he had COVID-19, and the people took off. So secondary stigmatization, you could say, but me directly, no, and I don't see why there should be stigmatization. Like we say, we should be we who are recoverers, people who are recovered, should be the ones stigmatizing people who do not know their status. I mean, you don't know your status, you could reinfect me, so I should be the one keeping a distance from you. So the joke's not on me, but really on you, on them, yeah.
Thank you so much, Doctor. Doctor, I saw that you really agreed with him.
Yes, I almost had tears down my eyes.
Oh, wow. And because I'm sure that as a doctor, even just talking about the IDH and talking about the fact that there were professional doctors, the place was a professional facility, I saw that you were truly touched by that. For you, how do you view this whole situation?
So let me start by what he just said. Maybe to paraphrase somebody, that it is those that recover that had pity on the sick and on the dying, because they know that the disease never affected the person a second time. I was talking about some disease in the ancient days. COVID is real. I've told some people that don't believe that even if an angel comes down from heaven, they still won't believe. But here's a testimony that COVID is real, and most people with the disease do well, get better. Not so with some other diseases that we deal with. The cancers are there, Ebola is there, Lassa fever is there, and it's probably even more deadlier than COVID.
So people would wonder, since just like you've rightly pointed out, most people with it do get better, then why has it shut down our lives so much? For example, why are you wearing a mask?
Good.
Now that you are with us here.
So I think the first response to COVID for anybody, and I don't blame them, is fear. So even for the doctors, you read in the papers that, a patient suspected of COVID showed up in the hospital and everybody took off. So that's the first response. It's only natural. But after a while, as human beings, we then look at the facts and ask ourselves, how can we sensibly, how can we rationally, how can we safely respond? That's why we are humans. So, like you said, why am I wearing a mask? I've told countless of people that I'm not wearing this mask to protect myself. If I need to protect myself, the mask is different. But I'm wearing this mask in the small chance that if I have COVID, I reduce the number of people I infect with it. So we know for now, if somebody has COVID, it may infect up to 2 other persons. But if we can keep that number under 1, then we quickly get on top of this. So my wearing mask is actually not to protect myself. It's to protect whoever I come in contact with in the small chance that I'm infected and I'm not aware of it.
And that will lead me to my final question, to break down this word asymptomatic. Because that is, for example, there are people that might visibly have it and we know, but there are many people that might be carriers of the virus who do not know, and which is why we also need to be responsible and self-governed. So what does it really mean to have the virus but be asymptomatic?
So we know the symptoms, fever, cough, breathlessness. He's talked about diarrhea, or what medical people will say gastroenteritis. We have other fatigue, headaches, all the symptoms that you attribute to other illnesses, other common illnesses in our environment. So when somebody has the virus, it means the virus is multiplying in that person. but has none of these symptoms. The person is living a relatively healthy life, going about his or her own business, but turns out to be positive on the test. That person is asymptomatic. You would think that during that period, this person should not be able to transmit or get other people infected. But for this virus, we know that even a day or two before the person becomes symptomatic, he or she is still able to pass that virus to others. And so the working with the knowledge that you might have and then trying to see how you protect the public is one responsibility that we all have to take. Like I tell people, the hand washing is to protect you. Not touching your face is to protect you. Avoiding public, if you can, is to protect you. But the one thing you can do to protect the public includes wearing your mask when in public.
Fantastic. Thank you so much, Dr. Zizobo, and thank you, Mr. Sika, for sharing your story. You are not just now a COVID doctor, you're a COVID superman.
Yes.
You are indeed, and we're congratulations on your recovery, and we hope to have many more stories of people like this that recover and that can come out and share their stories and would not be stigmatized. It's important that we end the stigmatization. Thank you both so very much. So we need to go back now to the main studios, to the main platform stage, not studio, where we'll be having another interview with the governor of Edo State.
The Platform Nigeria celebrates all medical and frontline workers in the battle against this epidemic. Some have given their lives to keep us safe. Nigeria and the world will forever be grateful to you all.